Life in the Western world is very much an existence of excess, where the greatest need is a faster pace and the strongest ally, progress. Meanwhile, a world away, developing nations want for the basic needs of human life. Nowhere is the disparity as evident as in the healthcare system. American hospitals discard an estimated 2 million tons of material each year into landfill sites, some of it unused or functional equipment simply outdated, while for many clinics in the developing world, the shelves are bare. Even when skilled practitioners exist, some patients will travel for miles only to find a doctor lacking the basic resources to properly clean and stitch a wound or protect the patient or themselves from infection. Common sense says there must be a way to build a bridge between the need in the economically developing world and discarded surplus in the United States. We believe Medshare International is that bridge. Medshare pairs surplus medical supplies with needy healthcare facilities in underserved communities around the world. From a 48,500 square foot facility in Decatur, Georgia, Medshare staff and volunteers sort, evaluate, rebox, and inventory the medical supplies. The inventory is posted online and updated throughout the day for web-based viewing. This allows recipient hospitals to see exactly what Medshare has in its warehouse. Recipient hospitals and clinics can then personally select the medical supplies they need and the quantity, item by item, box by box, thus eliminating unnecessary waste. The arrival of a Medshare shipment is always a special day for recipients. Letters, photographs, and visits say it all.
Well, my name is Dr. Jabu, Dr. Jabu Nyenwa. I'm the head of Celebration Health. We are excited about the partnership that has been established between Coca-Cola Africa Foundation, Medshare, and Celebration Health. Through this partnership, we've been given an opportunity to help the people of Zimbabwe in accessing the much-needed medical equipment. We have an amazing health infrastructure in this country that was established decades ago, about 2-3 decades ago. Unfortunately, this wonderful health infrastructure has been suffering over the past 2 decades from one, chronic lack of medical supplies, secondly from a lack of functional medical equipment, and thirdly from a lack of qualified human resources. We've seen through the opportunity that has been created with Medshare contribution towards one of the critical needs in this country, and that of medical equipment. We have been fortunate enough to be the recipients of a wonderful, amazing piece of equipment, the mobile CT scanner, which is really the first of its kind in this country, the first mobile CT scanner that has been donated. We witnessed this week the handing over of this piece of equipment to one of the biggest hospitals in the country, Harare Central Hospitals. And I must say, you know, in this country with a population of 13 million people, there is only one functional CT scanner in the public sector. This is obviously going to be a major contribution to improving access to health services in this country. We also should say that the other pieces of equipment that we have received are going to go a long way in relieving the pressure within our hospitals in this country. Not only have we received medical equipment, but we've been so fortunate this week to have Eben Armstrong visiting us, and it's been such a wonderful experience having him here, not only to look at the equipment that has been donated by Medshare, but to also give an opportunity to train our technicians. We have a critical shortage of health technicians or biomedical technicians in this country. The few that are there are not well trained, and they've not had an opportunity to receive any refresher courses or any retraining. So as a result, you know, we have equipment that is either not utilized properly or not maintained well, and this opportunity that we've had this week is just a demonstration of the amount of need that's there in training our medical technicians. So we really appreciate and very appreciative of the support that we've received from Coca-Cola to have this relationship with Medshare. We are appreciative to the senior management at Medshare give our appreciation to you. Thank you for sending Eben. He's been such a wonderful person to have, and we look forward to him coming back and working with us as we try and bridge the gap between those that have surplus and those that are in desperate need. We thank you so much, and we love you.